This is ulna. This is the medial bone of the forearm. This is the medial side and this is the lateral side. So this is the medial bone of the forearm. As it is the long bone, it has three parts: upper end, shaft, and the lower end. In the upper end, it has two processes and two knots: olecranon process, coronoid process, and trochlear knots and the radial knots. In the shaft, it has lateral border, which is the sharpest border. In the lower end, it has head of the ulna and the pointed styloid process. And for the side determination, we need to see this upper end, which looks like hook with its concavity directed forwards, while in radius the upper end is rounded, as the R for radius and R for round, while in ulna it looks like U-shaped, hook-like. So this is the upper end. And in the shaft, we need to see the sharpest border, and the sharpest border should be placed laterally. And in the lower end, this pointed styloid process should be placed posterior-medially to the head of the ulna. So this is the right side of ulna of the right side of the forearm. As we can see in upper end, it is hooks like, and in lateral border, this sharpest border should be placed laterally, and this lower end, there is pointed styloid process, which should be posteriorly medially to the rounded head of the ulna. Features of the upper end of the ulna: it has two processes and two knots: olecranon process, coronoid process, and the trochlear knot and the radial knot, which is placed laterally. And the olecranon process has five surfaces: anterior surface, posterior surface, this is the medial surface, lateral surface, and the superior surface. This anterior surface is articular and forms the upper part of the trochlear knot. This is the trochlear knot and forms the upper part of the trochlear knot. This is the anterior surface. This is the posterior surface, which is placed posteriorly. This is the medial surface. This is the lateral surface, and this is the superior surface. And this is the superior surface. The anterior part is covered by bursa, and the posterior part is roughened as the triceps brachii get inserted in the posterior part of the superior surface. On coronoid process, it has four surfaces: superior surface, which form the lower part of the trochlear knots. This is the trochlear knots, and this lower part of the trochlear knots is formed by the superior surface of the coronoid process. This is the anterior surface, which is triangular and the rough, and its lower corner forms the ulnar tuberosity. This is the ulnar tuberosity. And on the lateral surface, it has radial knots for the head of the radius, and on medial surface, it continues with the medial surface of the shaft. And it has two knots: trochlear knots and the radial knots. This trochlear knot articulates with the trochlea of the humerus to form the elbow joint, and this radial knot articulates with the head of the radius to form the superior radioulnar joint. And the shaft has three border and three surface, and the three borders are interosseous border or lateral border, anterior border or the posterior border. This interosseous lateral border is sharpest in its middle 2/4. Inferiorly, it is traced to the lateral side of the ulnar head, and superiorly it continues with the supinator crest. And this anterior border is thick and round. It begins at the medial side of the ulnar tuberosity. This is ulnar tuberosity, and this is the medial side, is the lateral side of the ulnar tuberosity, and it begins at the medial side of the ulnar tuberosity, and it's at the medial side of the styloid process. And this posterior surface is subcutaneous, and it terminates at the base of the styloid process. And there is three surfaces in the shaft: anterior surface, posterior surface, and the medial surface. And the anterior surface is between the anterior border and the interosseous border. And in its upper part, there is nutrient foramen through which nutrient artery passes, which is the branch of the anterior interosseous artery. This is the medial surface, which is between the anterior border and the posterior border. This is the posterior surface between the interosseous border and the posterior border. In lower end, there is head and the styloid process. This head articulates with the ulnar knots of the radius to form the inferior radioulnar joint, and this styloid process is projected downward from posterior-medial side. There is groove between the styloid process and the head of the ulna for the tendons of the extensor carpi ulnaris.